Okay. So good morning, everybody. Sorry for the delay. I had issues with my camera, so I'm currently using my cell phone. Um, my name is Dr. Yasmin Munir Ibrahim, and I'll be your moderator for the session today. So I would like our speakers to please introduce themselves to everybody, and we would have, after this session, we would have a 10-minute Q&A where everybody will be free to ask the questions that they want answers to. But before then, I would encourage everybody to type in their questions in the comment section so that by the time we're done, we will have an idea as to what the questions are, and it will be easier to recall any question that you have to ask. So I would move to my first speaker.
Okay, thank you very much. Did I just get myself into trouble? Thank you very much. It's a pleasure being here, and thank you to the organizers. My name is Dr. Boris Atoki. I'm the Chief Executive Officer of ABC Health. ABC Health is acronym for African Business Coalition for Health, and we're a social enterprise set up by Alhaji Aliko Dangote and Mr. Aibuje Mukwede, where African business leaders coalesce to share ideas and get better informed on how to participate generally in health, and more importantly, to mobilize their resources to improve health outcomes at a continental level. So it's a pleasure to be here. Over.
Thank you very much for joining us. So next will be Dr. Hadiza. Okay, Dr. Amina, please go ahead.
Okay. Hello, good morning, everyone. My name is Dr. Amina Abba. I'm a physician, so specializing in general internal medicine. I live and work in the UK. I have about 17 years experience working for the National Health Service here, and I've done various visits volunteering in Nigeria. I'm also very passionate about medical education, patient safety, quality improvement in healthcare, and I coach and mentor medical students and doctors. So thank you for the invitation, and I'm looking forward to a very interesting session.
Thank you very much, Dr. Amina, for the story. So Dr. Omolola should be here with us.
Yes.
Okay.
Good morning, everyone. It's a pleasure to be on this eminent panel. My name is Omolola Salako. I'm a consultant clinical oncologist. There are just 85 of us in the country. But really what I do is I help cancer patients access cancer care. I work with Pearl Oncology Clinic as the Chief Executive Officer. And what we do is really to set up cancer clinics in established hospitals in very, very remote places so that cancer patients can have access to care. I'm also the founder of a cancer app called Oncopadi, and also the founder of Shebekli Cancer Care, an NGO that has done many things like attempting a Guinness World Record for breast cancer. Thank you.
Thank you very much, Dr. Omolola Salako, for that introduction. And next we have Aiwanose Odafe.
Hello, everyone. My name is Aiwanose Odafe. I used prior to this, I used to work with Hinton Health Access Initiative. What we did was we worked with government organizations to meet certain individual goals in regards to, in particular, vaccines financing and family planning financing, and also helping take up of vaccines in the country across different states in Nigeria, and then also helping the take up of family planning.
Okay, thank you very much.
I'm a writer, a full-time writer.
Oh, okay. Thank you very much for that. So I will throw a few questions to you for you to give us an idea of a life in the healthcare system, healthcare sector, where you all have a lot of experience. So the first question will be, how did your earlier choices and experiences, both educational, professional, and also business, lead you to where you are now and shape your success? So I'd like to start with Dr. Amin Abba.
Thank you very much. I would make a journey of my start from childhood. It all started from childhood. I was very passionate about learning about human body and science, and wanted to serve humanity. That was the beginning. That was the initial spark. And throughout school, I maintained that focus and intention. The reason why I actually went to medicine was shaped by a few unfortunate circumstances in my family and people that were close to my family. So one of my favorite aunties died in childbirth from nothing to do with childbirth, but because her asthma was mismanaged. So that really sparked me to get into healthcare so that I can contribute. I also come from Borno State. At the time, a lot of for cultural reasons, people, especially women, weren't feeling comfortable accessing healthcare because there weren't many women physicians or doctors. So unfortunately, because of that, a lot of people were not getting diagnosed early and had poor health outcomes. So I made a vow to myself that that won't happen under my watch, and I'll do everything I can to do my bit and contribute to the healthcare industry. That led me to where I am. I'm currently in the UK. I've done all my training here, but always there was something about, I want to go back home and give something back. So I've done multiple visits to Nigeria in terms of medical education, training, also service and quality improvement projects, as well as mentoring leaders in healthcare to improve access to healthcare as well as the quality of healthcare. So here I am. Currently, I am contracting my services in terms of being an entrepreneur to the National Health Service. And I have built a company mainly around coaching and mentoring doctors. I realized that there's so many initiatives in terms of helping patients, but medicine is a very, very stressful career, and doctors themselves are human beings and need support. So currently that's my new passion in terms of coaching and mentoring doctors. So I'll stop there.
Okay, so I'll also like the same question to Dr. Atoki, Dr. Morris.
All right, thank
So
you.
how did your earlier choices and experiences lead you to where you are now?
Right, thank you, Madam Moderator. I think a good place to start is to correct a presumption. I am not a medical doctor. My doctorate is not also in medicine, so let's
Still a doctor.
let's have that. But I say that majorly, and I like the question. I like it because it also helps me to think about how did I get here. I think that the founders of ABC Health particularly had a vacuum. They had a vacuum because, as you would have it, across governments, across many other institutions and agencies, you typically would have medical experts or health professionals take the role where health is the major sector that is being driven. In my case, my predecessor was of that, but there was more realization around the fact that the health sector of Africa needed a lot more multi-stakeholder approach in the sense that African governments aren't doing particularly well as far as funding and supporting public health. And therefore, there's a growing necessity for businesses to be involved either by contributions or donations or public or philanthropy kind of giving to the health sector. And so my founders, my bosses were not looking for a health expert anymore. They were looking for somebody who had, who was comfortable to engage the business community. And I've had over 20 years experience across that area. 12 years in Ernst & Young and PricewaterhouseCoopers as a consultant, engaging the business community, both at a multi-sector level. And 3 years ago, I found myself, and well, before then, I was also a sustainable development go-to person. So by virtue of what I did in the PricewaterhouseCoopers, I would engage a lot of corporates on how to build their sustainability businesses to make their businesses to be sustainable, and how to become, a sustainability-driven kind of person or individual or company. And that took me to the sustainable development world, cutting across education as well as healthcare. And voila, 3 years ago, I found that opportunity to join ABC Health, to focus on health, to speak the language of businesses and private sector, and engage with the health community to be able to move health forward in Africa. Thank you.
Thank you very much for that. So my next question will be directed to Dr. Omolola Salako. And the question will be, what would you consider are the critical success factors for professionals and entrepreneurs in your industry?
Okay, so is this specific to the oncology industry or healthcare professionals in general?
Healthcare professionals in general.
Okay, so I think the first thing is to know what is to be self-aware. If you're going to be a medical person who loves your clinical, stuff, stay there and thrive. If you're that person who wants to work in a very efficient system and you want to go abroad, that's fine. If you're like me, where you want to stay back, build the system, even when it doesn't make sense, and increase access and help people. So I would say the first thing for success is really around self-awareness. The second thing is you have to be competent. Whether you're here in Nigeria or you're wherever in the world, you have to be competent and you have to continue to develop your skills. Not just clinical skills, but also financial skills. And I agree with Madam who spoke earlier that there's that intersection where physicians interface with the business world. And there's a lot of statistics and research that says physicians in the top 3 hospitals in the United States actually make better managers managing hospitals, the biggest like Mayo, Harvard, and stuff like that. But it's also been found that physicians are not great at, managing this simply because it has not been imbibed in their curriculum. So in this 21st century, for you to be successful, learning from the past, why people haven't succeeded, it's to be self-aware, be competent, and then you just continue to learn. And the true definition of entrepreneurship is someone who's able to take on risk at, believing they will make some funds or some profit in future. So if you do not have the mind for it, healthcare professionals in entrepreneurship, then don't go for it, because our training as healthcare professionals makes us to think very logically. If you do one, it will result to two. But in business, it's not that way. So you really have to be self-aware and know where you're heading. And I think that's the crisis we have. People are traveling a lot, not knowing why they're going. People are saying, oh, we want a better system. But the truth is you can create a better system in Nigeria. And then some people really have to go abroad to learn stuff abroad and then bring it back home, like the first speaker is doing. Thank you.
Thank you very much for that. I would also like to throw my next question to you. So what are the biggest trends and opportunities you see in the industry, and how can one take advantage of these opportunities?
I would say prioritizing the patients, make them feel very comfortable. From my experience as an oncologist, cancer care is complicated. It's most times a lot of our survival outcomes are very poor, but even at that, taking care of the patient as a customer, as a client, is crucial. Whether you're in the diagnostic in the hospital, take care of the patient so that the lifetime value of that patient in your facility is very high. So I don't know if that's a current trend or it's from the past, but businesses have to pay attention to what the patients need. The second thing will be, everyone knows about technology, but I would like to say more of innovation. You don't necessarily have to create a new thing or bring in a new app. I would say everyone should look at the trend in their business, what's making their hospital, what works in their hospital and what's not working in their hospital, and innovate in that area. The third thing, trend, I don't know, you caught me.
We can also ask Dr. Amina, do you have any contribution as to the biggest trends and opportunities you see?
Yeah, I concur with Dr. Omolada about the technology. There's a lot in AI now. So many of the services are being transferred to robotics or the virtual reality, especially in surgery. But I agree with her. I think the biggest trend is leadership and management in healthcare, and the emphasis on servant leadership and compassion. I think the majority of what we're seeing now is they used to be a business focus or profit-making focus, targets and things like that. But what we're finding is when you focus mainly on targets, you tend to cut corners in terms of actual quality of patient care. So it has to make sense, the economics, the metrics for quality, and also the actual service delivery. So getting that right, having that balance is key. But for me, my focus is you cannot talk about patient safety or patient care without looking at staff welfare, because obviously the staff, there's a lot now, what the previous speaker was speaking about, brain drain, the retention of talent and the retention of staff. If you're losing your staff at an incredible rate where you cannot replace the staff, that again affects the business, affects the outcomes, affects the income of organizations. So it's very important to invest in your staff and look after them. And invest in things like coaching, welfare support, and also engaging your staff and listening to them. So I think that's the biggest trend. Otherwise, you will lose your staff and they will try to go to greener pastures. And then that affects the business. So that's my contribution.
Okay, so I'd like to throw the same question to Aiwa Nuse.
Sorry?
So the biggest trends and opportunities you see in the industry, and how can one take advantage of these opportunities? Maybe one you can share with us.
Oh yeah, sure. Sorry, because like the biggest trends and opportunities. I think I think right now, like the healthcare space in Nigeria particularly is very vast. You know, there's so many different aspects, and even now with like about I'd say the biggest trends and opportunities definitely lie around. Speaking from my own experience in vaccines financing, definitely there's so many opportunities in terms of vaccine storage. I know of young, intelligent people that came up with solutions to, because what's happening is like one major issue that's really affecting healthcare in Nigeria is storage of storage and care for not just vaccines but for other sorts of items that need to be need to be transported to the rural areas where people really need them, you know. And so people are coming up with innovative solutions to solve this problem, because we're experiencing really high wastage. Our wastage is higher than normal than the average countries in according to WHO standard. So coming up with solutions to these issues on how to, because the rural areas are still not being reached to an extent. There's so many opportunities to expand reach, to expand opportunities for people in these areas. So just addressing the need in this area and addressing the gap in this industry, I've seen a lot of people come up with different innovative solutions that have been picked up by international organizations, especially in regards to storage, vaccine storage, coming up with because a lot of storage equipment are not suited for our climate, you know. And then what happens is these storage equipment don't work the same way. They break down, or they don't, or they are not easily transportable to these areas that need them. So coming up with solutions to these issues. I think just in general, the healthcare space is about seeing a need, especially from an entrepreneur's perspective, seeing a need and making an effort to address it. So what need do you see that exists in your area? I'm speaking from the area that I've worked in, but then seeing just like in your area, what need do you see that exists, and how do you think that need can be addressed? And I think that's the foundation of entrepreneurship anyway.
Okay, I would also like to direct the same question to Dr. Morris for one trend and opportunity you see in the industry.
Yeah, absolutely. I totally agree with all the speakers. But I'm just going to lash in on, the last speaker and kind of amplify it. I do believe that there's a big space around supporting health entrepreneurs in terms of building capacity to access funding. So these innovators that my previous speakers spoke about, and fantastic ideas they bring, but again, who helps them to bring that idea into fruition? So they've identified the opportunity, they know there's a problem. Who is enabling them and who's helping them get the right kind of partnerships to mature their ideas into bankable projects, into projects that the likes of the Clinton Foundation will be attracted to? I think there's a big gap in Africa around just assuming that medical practitioners and health experts understand the nitty-gritty of finance. It's like an assumption, they should know it. And then they get to the banks, and the banks are, well, it doesn't look like, we want to do this. Meanwhile, we need them. We need to support them. For us, it's almost like they're the next frontier to mop up that expanding gap that governments by default, an insufficient or inability to cater for public health appropriately as cost. So for me, I do believe that more and more there should be attention in that regard, attention, and also some level of foundational attention, again, if you may say, in the sense that for African medical students, you don't just leave them out there to graduate from medicine and assume that, oh, they're going to pick it up in one way or the other. They need to understand more of the economics, like Dr. Amina spoke about, the balance. The balance is necessary actually at a foundational stage. And I see Africa is situated, because again, in the last 20 years, 2 decades, it's almost as if we've been unable to pick up the issues really and address them adequately. A lot of the grassroots, a lot of the communities are not being attended to. We still want doctors, people who go to clean medical schools in Nigeria across nations to actually go to these rural communities and be doctors there. You ask yourself, would you be able to send your own daughter or son to these rural places to attend to them as doctors when sometimes they can't even access clean water? Doctors die there because they are not being catered for. But if there's attention by the government, not necessary for the government to give funding, for the government to create an environment where doctors can understand more how to access funding, whether internationally or locally, from the very foundation of medical schools before they get outside there. Then even at government level, there's a preparation for the private-public partners that they are looking for to expand some of these areas of medicine that needs to be expanded. And then by that, government itself can earn revenue when this capacity is built for the health entrepreneurs out there. And there is funding, also accessible to these entrepreneurs. There is attractiveness to investors, to these entrepreneurs, and so on and so forth. You see, the issue that I see the biggest is that there's an assumption that Africa is going the route of other developed nations, and we're not. We're not, in the sense that getting grants and getting free money from foundations is dwindling and is going to reduce. It's going to continue to reduce. I mean, the likes of COVID has made it clear that countries are likely to give more attention to themselves than before looking, out there to who they're going to support. At the end of the day, the business community is largely going to be responsible for the healthcare of the nations, because again, you need to take care of your employees. If your employees' healthcare is not being taken care of, you'll have an economy that you cannot even really particularly boast of. At the end of the day, what we're looking at is more and more attention, conversations like this, helping us take it out there that medical practitioners, health entrepreneurs need the support of building capacity to access funding, the kind of funding that they require for the right level of strategic partnerships to enable them to be able to build quality hospitals, deliver quality healthcare, and partner with governments to deliver the right kind of health care. Over.
Thank you very much, Dr. Atoki, for that, for your speech explanation. And I would like to direct one final question to Iwanose. So what advice would you give to your younger self at the start of your career?
Oh, that's a very tough question. Wow.
Or even your business.
Sorry?
Or even your business. So what advice would you, just one, so we could, everybody could say one.
Yeah, sure. Okay, what advice should I give to my younger self? So I've had obviously we couldn't really go into that in detail, but like I've had like my background. I'm not a healthcare professional. So my career has sort of gone through different phases. So I think the advice, but then I've always sort of believed in like what happens always happens like the way it's supposed to go. So I think what the advice I'll give myself is not to worry too much. It's probably very simplistic advice, but to sort of giving your best in the very moment, you know, because like I think a lot of my younger years were spent like really like trying to, you know, they tell you plan the next 10 years, plan the next 5 years. Yes, it's good to plan, but things hardly ever go as planned. And then when that happens, not to panic. I think that's also very essential in business, because they tell you to forecast, to do this, to that. And an account, I can tell you the first rule of forecast is like your forecast is probably false. So but when we prepared for the unexpected, so when things don't go the way you plan, just keep kicking it. That's the advice I'll give to my younger self.
Okay, thank you for that, Dr. Amina. Same question.
Yeah, I mean, I totally agree with the previous speaker. I would just say take it easy, because I think for me, our profession, it is tough and but exciting at the same time. So keep your intentions pure. I feel like one of the things that we're fast losing in our profession is the ethics and the morality. So always revisit your intention. Why are you doing what you're doing? For me, it's for the sake of God and for the sake of the goodness of humanity. So I always have to, whenever I have a tough day, I revisit my intention. Why am I doing this? Okay, this is the reason. I'm on track. And then enjoy the ride. Life is too short to worry about little things. That's it.
Same question to Dr. Atoki, please, Dr. Morris.
Well, this is really quite refreshing hearing from the other two speakers. Even me, I think I took some learning points there. From my end, I would be a bit harsh. So I will say that have a global mindset. So in other words, be aggressive about knowledge. Gather all information that you can, but a local outlook, a local understanding of what the domestic situation is in your respective countries and in Africa at large. So no matter how much you train out there, or you get exposed in a positive way, get interested in the local problems and in the local situation that your country actually has to deal with. Over.
Thank you very much for that, Dr. Omolola. Same question to you, please. So what advice would you give to your younger self at the start of your career and or business? Hello?
Hi, Ken. Okay.
So, Dr. Omolola, over to you.
Okay. Thank you. So I would say to my younger self to take more risks, don't be scared.
Okay, me, I have a question personally. I can comment. I would like to find out, because I was very interested when Dr. Morris was talking about access to funding for healthcare professionals. Yeah, so I would like to find out exactly the channels, if you have any recommended channels for access to funding for healthcare projects or programs or businesses. So because there's a lot of information out there, but we can't be sure of which one is right or which one works or which one is will give you the answer you're looking for. So if you have any recommended channels for access to funding.
All right, Madam Moderator. So, and I just feel that this question is largely what a lot of other entrepreneurs will want to hear more about. What I don't want to particularly give you a channel, because there are many channels, trust me. The next bank to you is a potential channel. What you need to have is the how. And so over time, even including myself, I realized that when I was younger in career, because of my young numbers as well, I wasn't able to access the kind of funds that I wanted. But as I mature in career, I got more attractive to banks, and I could take a loan. I was bankable. You know what I mean? Therefore, what I want to say is the African Business Coalition for Health, for instance, we have a platform called the Academy for Entrepreneurs, and in bracket we have Africa. It's a venture building master series, master classes, and it's a series where we bring together the best. Globally we hunt for the best kind of facilitators across investment banking, financing, to help us support and build capacity for health entrepreneurs. We're doing it at an African level. We're starting up in West Africa, hubbed in Nigeria. And this actually offshooted from a UK-based event that I participated in Nigeria. So I saw that there was, there was an idea around doing that, and I kind of gave them I sold the idea of, why don't you make it like, a pitch, take it away from the regular panel discussions and make, the entrepreneurs come and pitch to the investors, because the investors were going to be there and the health entrepreneurs were going to be there, so that they can right there and then have the opportunity to decide what entrepreneurs they want to invest in. And it became, more and more of a big conversation. We were in the UK in June, earlier in June, to have more discussions around it. And that birthed this academy that I talk about. I know about the one we're doing, but what the message I want to send to you and to government and to all other health entrepreneurs is that you must realize that you are not in a place yet to access those funding, mostly. So some get away with it. The likes of Clinton Foundation and other foundations, for instance, they also have a target. They might, need to address a particular situation, and they need health entrepreneurs. So sometimes they might actually reduce their, their search specs or lengths to be able to do that. But again, I do have the belief that is going to, in time, fizzle out. And what we require, what you guys need as doctors, as health professionals, operating in Africa, operating in Nigeria, is that ability to be able to convince a bank, convince a financial institution or a funding party that you are capable of defending your business, and you require that funding in a business, from a business point of view, and not necessarily as a grant or as or money that is a contribution. Because more and more, what happens is that when you keep relying on those contributions and those grants and those, loosely talking about funding, like, just give me the money, I'm here to save lives. You see, the bank is never going to be rude. They will scope you until you get really tired and frustrated and you cannot come back to them. And it's important for us to have the hard conversations right there in schools, right there in innovation hubs, right there, anywhere you have entrepreneurs where the capacity is being built. One of the very important areas is to support them to be able to access funding for their businesses, especially established health entrepreneurs who already have existing businesses and are looking to scale. I hope I addressed your question a little bit, because I saw that I danced around it. But really, I don't have the capacity to tell you the where, but I can tell you the how. Yes. And that's the how, really. Absolutely.
Okay, so thank you very much for that. To our audience, does anybody have any question for our panelists? Okay, no questions. All right, so I would like to thank each and every one of you for taking out your time to join us today. Special thanks to Dr. Amina, Dr. Maurice, Dr. Molala, and Iwanose This was very informative. I actually learned a lot. And so thank
Madam
you.
Moderator, there's a question that just came in. You might want to look at it.
Okay. Okay. Oh yeah, from your Elijah, if I'm correct. So okay. So the question is, how can we improve patient to doctor relationship in a country like Nigeria? Just quickly, Dr. Omolola can answer that for us.
Okay. Please confirm you can hear me.
Hello?
Yes,
we can.
So to improve the patient-to-doctor relationship, just go back to number one, being human. Always remembering that you for a reason, and you actually have some or all of the solution. Number two, follow the books what you were taught in school. We have bedside manners. Just follow the log written there. And number three, in reality, some patients will test your patients. Make sure you don't fail. So that's a decision you have to make with these. Your patient know how you're going to handle it. And when you cross the line, then be ready to face disciplinary actions, be ready to apologize. Thank you.
So thank you very much for that. We have another, I think this is the last question we'll take. So well, it's not to, how do we stop the JAPA movement of doctors in Nigeria? So JAPA movement basically means the exodus of Nigerian doctors. So I would like to maybe speak to Dr. Amina about that, because she's currently not in Nigeria, so she can give us Yeah, so Dr. Amina, over to you, just quickly, then we round up.
Oops. My mic is not working.
Oh, we can hear you.
Can you hear me? Ah, okay.
Yes, we can.
That's great. That's an interesting question. I don't know whether I'm the best qualified to ask this, but one thing is that the grass is not greener on the other side. So I have a lot of, it really depends on why is the movement, what's driving the movement. I think it's different for every individual. So first of all, we need to understand what's driving the movement. And secondly, to address the root cause. With everything, there's a complex answer to this question, and in 1 minute it's very difficult to address. But there are things that you have to look from the individual who's choosing to make that movement. What is it about them? And at the end of the day, it's choice. Secondly, it may be that they're looking for better financial, better training, possibly, and better lifestyle. Maybe that's what they're thinking. But I think when I see doctors coming here, there's a lot of adjustment issues, and sometimes things are not the way that they have been sold to. They have to really, they also looked at with scrutiny, and there's a lot of cultural differences in terms of training. So I think really we need another panel discussion for this issue. It's something that is very close to my heart, which is why I have chosen to mentor and coach doctors from both sides of the Atlantic. So, but I think the thing is not to stop the JAPA movement, but to understand what's driving it and address those issues.
Wow.
For the betterment of both sides, the country, the individual healthcare professional who's making that choice, and also even for the countries that they are migrating to. So it needs a very complex end-to-end analysis and then questions.
So thank you very much for your answer, Dr. Amina. So I would like to formally close this session and thank our panelists for taking out their time to join us and give us answers to a few questions we had. And we hope to have another session sometime in the nearest future to discuss one of the things being the Japa movement. And if any other questions come up, we'll address them to you. But for now, I would like to say thank you very much. And we hope to keep this relationship going forward and see how we can all do our part to improve the healthcare system in the country. So thank you, Dr. Omolola, Dr. Morris, Dr. Amina, and Iwanose for joining us. And so see you some other time. So thank you.
Thank you, Madam Moderator.
Thank you for having us.
You.
Bye.
Thank you.
Yeah.
Continue.
Bye.
Bye.